Welcome to the Moms Who Know podcast, the podcast that helps moms take care of themselves so they can take better care of everyone else. This episode is sponsored by my program, Step by Step to an Amazing Morning Routine. This program will help you to create stress-free mornings. To get all the details, visit momswhoknowpodcast.com. Hello, everyone. Thank you so much for tuning in to the Moms Who Know podcast. I'm joined today by Azam Anwar. Dr. Azam Anwar is a fun guest to have on the show. We are going to dive into all things skin and things that are really going to help us as moms. So, Dr. Anwar, thank you for being on the show.
My pleasure. Look forward to it.
Yeah, I am really interested to start off and learn a little bit more about you and your background. Now, before you tell us your story, I want to read your bio so people can kind of know who they're listening to. So Dr. Azam Anwar has over 25 years of clinical and high-level research and innovation expertise. And I usually this bio is a little bit, has some details, but I actually want to go and read it because as I was reading it, I was like, wow. And I think my listeners, I think you'll be the same way. So hang with me and I'm going to go ahead and read through this. He successfully developed medical devices, founded the Interventional Cardiology Fellowship at Baylor University Medical Center. He spearheaded the formation of a world-renowned heart hospital. He also has spearheaded multiple company formations and board memberships. He collaborated with dermatologists and chemists to invent a line of sodium hypochlorite cleansers because he noticed that there was a need for that. And we're going to talk a little bit today about his inventions and his contributions to skincare. So to start off with, I would love to hear kind of what got you interested in skin health and kind of your own background and experience with this.
Sure. I practiced medicine for a very long time, over 20 years, and have a history of developing medical products. We developed one in the very early heart stents. And about 10 years ago, I became a patient myself. I developed a skin infection, very minor scratch on my left shin, size of a rice grain. And this thing expanded very rapidly over 1 week, the size of a silver dollar. And went to my friend and dermatologist, and he looked at it and cultured it. And it was a cellulitis, which is a infection of the tissues, superficial tissue layers of the skin. And it was secondary to a bacteria called MRSA, methicillin-resistant staph, or the bad type of flesh-eating bacteria. And received antibiotics and topical cleansers, Hebacleanse or chlorhexidine, the pink soap that everybody's familiar with. I was intolerant of that. And then he recommended a medicated bath, which is a little bit cumbersome to use. He put, half a cup or quarter cup of, Clorox in the bathtub, and you're sitting there. Actually, it sounds scary, but it's fairly easy to use, but it takes, 20 or 30 minutes to sit in that bathtub.
So actual Clorox, like Clorox bleach in your bathtub.
Yeah. Okay. So it's called a bleach bath or a Clorox bath, and it's been used for a long time in medicine. But when you tell a mom or somebody else, they really are, quite fearful of it. And I can understand why. I mean, you're, preparing this, very small amount. I mean, I'm talking about a quarter cup of this Clorox and half a tub of water. So the Clorox is diluted 1,000-fold. Well, I used that for a couple months, 2 to 3 times a week. And then, after sitting in that bathtub for about 10 minutes, then you have to rinse off because you got a little bit of a smell there and so on. So I went back to my friend and I said, listen, I think we can develop something better. I really looked into this thing. I've got a background in medical devices and there's a huge need, but whenever the skin doctors or infectious disease doctors tell people to do this, they actually don't do it. So one of the most important things is for the patients to follow the instruction of the doctor. Well, the instruction has to be sensible and easy. And so, from a medical standpoint, this is effective, but it's not going to be very effective, and 9 out of 10 people don't use it. So we dug in and hired some chemists and so on. So let's create something really, really simple and that can be used in the shower as just a cleanser, like a soap. And so spent 3 to 4 years getting the main ingredient, which is sodium hypochlorite, main chemical, and figuring out how to mix that in a format that was super easy for people to use. And it wouldn't take 30 minutes. It'd take a minute or two to use, and it would be just like the soap that you were used to using. So we did that, and then we did some clinical studies in children with eczema, because children with eczema have a lot of problems with irritation, and staph bacteria drives that disease. So whenever you see a kiddo with eczema, if their lesions are open and red, often there's Staphylococcus aureus bacteria cultured from those areas. So we did 2 studies in the children, and as young as 6 months, and got terrific results. Just with a cleanser, you just wash with it, no prescription.
Now that's really interesting, because I know, first of all, this is a really common thing that I see, online and in groups, Facebook groups that I'm on, and things that moms are dealing with a lot is with eczema of their kids, and nothing works. Now, my younger sister had eczema really bad, and she would get like you said, the red patches. I remember she had one on the back of her neck, and it would hurt whenever my mom brushed her hair because it was right there. And all the things that I think that they tried were lotions. So this is pretty rare, because everything that she was, doctors would recommend or that friends would suggest I can't think of any cleansers that they use. So is that a pretty, just the fact that it is a cleanser and not a lotion, is that a pretty different form of treatment?
Yeah, exactly. So the incidence of eczema, as you mentioned, is really increased. It's doubled and tripled since the 70s and 80s. We can talk about the reasons for that as well, which are mainly unknown, really. And in the past, it used to be felt that, hey, you don't want to overwash and over dry the skin, because the skin with eczema is really dry and it cracks and then it gets infected. So the concept that you can improve eczema with just a non-prescription cleanser is rather new. It's really, really, it's very new, and we're proving through our research and the results that cleansing is really the first step, if it's done well with the appropriate products that have some impact and doesn't irritate the skin or dry the skin, is really the place to start. So you're absolutely right in your experience that 9 out of 10 mothers or parents do not believe that the medications are adequate there for the eczema population. And 9 out of 10 believe that the doctors don't know what they're doing. This is from the survey from the National Eczema Association. And I feel the mother's pain, because I don't have a background in pediatrics, but I've really learned a lot about this. They end up going to multiple doctors, and the research shows that on average, the moms are taking their kids to about 5 different doctors.
Yes. Not to mention becoming an internet expert at home, right? Because you only have a few minutes with each doctor. And so you're studying and reading and trying to figure out all this stuff, because, the answers you're getting, like you said, they're not sufficient. They're not solving the problem. So exactly. I get that on a frustrated mom level. Yeah.
Yeah. Very, very stressful too, because the young child is crying and irritated. They don't really understand. They're not sleeping well. So they have learning issues and tired. And then another sibling does not have eczema and one has eczema. The one with eczema is getting all the attention, so the other one feels neglected. So there are just a lot of issues going on. Just being a mom is difficult, but on top of it, you add all those other things that I mentioned. So it becomes really quite difficult.
Yeah,
And
definitely. Now, I want to circle back to something that you said. You had mentioned that we don't know all the reasons why this is increasing. I'd like to talk about whatever reasons that you do know or other things that are kind of contributing to the increase in skin issues.
yeah, I think that there is a theory that children are not exposed when they're very, very young to all of the bacteria and so on, um, the way they used to be. We may be almost too clean when the children are, super young. And, I'm talking when they're infants, a few
Yeah.
days old. So, and then when they get exposed to, dry skin and bacteria and so on later, that they overreact to that. Okay.
Okay.
And over time, most of the kids, grow out of the eczema. Some of them continue to have an adulthood. So that's one reason. There's also a lot of, dietary issues with, milk and nuts and, coconut and, there are a lot of extraneous factors there. I think also, we're getting more and more virulent bacteria because of the overuse of antibiotics in our society. So having said all of that, and then on top of that, people are also allergic to a lot of things that they come into contact with. Like my young, daughter, she was just having issues when she had two different beds. We had another home that we'd go to, and she would always flare up. Her face would flare up. Well, it turned out it was one of her toys. She had a little bear there, brown bear, and we took that one out, and she was fine. So it's just really a number of things. But once the skin cracks, the staph bacteria seems to take a hold there, and it drives the disease to be even worse. So we also know that when the skin cracks, the staph bacteria are actually moving into the skin a day before the flare, and the flare is there. The skin is really red and irritated, and then the next thing you know, they're getting better, and we see that the bacteria actually leave the area or get better or not as prevalent, and then the skin gets better. So it's multifactorial from external and internal factors. And whenever you have whenever you have to see so many different people per condition, it's generally multifactorial, and we try to peg it into one area. So it's probably a lot of different reasons. In our experience, we found a number of people that we break the cycle with the cleanser that we've created. They're having all sorts of problems, and then you just get it washed and get rid of the staph and so on. And the product probably has other properties that we don't really understand, and that cycle breaks. And the skin heals, and they need less steroids. And, obviously, we avoid antibiotics if we can.
Right.
So it really simplifies their regimen. On the ones that are really driven by staph, those that, if they have an allergy to food or something, some other thing is driving, we may not be able to help.
Okay. Now let's shift gears a little bit here and talk about before the flare up, or even kids who just have really dry skin. How can moms prevent these kind of flare ups from happening? How can moms take care of their kids' skins and really be proactive in skincare, I guess? What are some things that you recommend, being kind of in this field and seeing, the big picture?
Yeah, I think there should be a maintenance program where the child really is very familiar with, cleansing with a gentle cleanser and getting moisturized and adequate nutrition and all those good things. Once a child is starting to flare or break out a little bit, I think people should jump on it pretty quickly so that you can get it, stopped early, as opposed to letting it go too far. I think children that are around sports, or they get overheated, you have to be aware of, so-and-so is going to have a problem when it's March because there are a lot of allergens out there. And so you have to be, really more vigilant. Others really flare up more in the summer because the staph bacteria and so on are more prevalent. They get sweaty. Check their skin folds, check behind the knees, check on the folds of the elbow, behind the neck. So really, I think being vigilant, wearing clean cotton clothing, tight, avoid really tight, clothing, and especially in the summer, that's going to really disrupt the skin some more. And then with kids that itch a lot, you really have to pay attention to their nails, because the nails carry a lot of staph bacteria. 94% of kids with eczema, when they're flaring, their nail beds are full of bacteria. So they're just, itching themselves with something that's already infected. So brushing the nail beds, I think will be helpful.
Yeah.
Honestly, I would get on with some of these groups that have other moms. The moms are the absolute experts on eczema. And try to create relationships with other people that have had children with eczema and what they've tried. And, you have to wade through some of these, but, people are really willing to help. I learned more about eczema, and I'm not a dermatologist, but I learned more about eczema. I learned a lot from my dermatology colleagues on the science side, but I learned as far as the care of the patient from the moms, the doctor moms.
Yeah, I know. It's so true. It's so helpful to have other people to bounce ideas off of. And one thing that I find is really helpful, obviously you're not going to your mom friends for a diagnosis, but people can help you know what questions to ask. Oh, ask your doctor about this, or ask for this test, or has your doctor heard of this? And those kind of things are so helpful because, like I mentioned earlier, we have such a short time with our doctor, right? So It's so helpful to go in kind of armed and ready and have these ideas. And that's why a podcast like this is very helpful, because people can say, okay, well, I'm doing this and run this by my doctor, and I've tried this and I want to try this. And then you're much better prepared for that few-minute doctor visit that you get.
Yeah, I wanted to throw one other thing there. I think when you get your wits end, try to see a pediatric dermatologist. There aren't a lot of them there, but they're in all the major cities. They specialize in this. They see tons of these kids. They go to the conferences. So a pediatric dermatologist or a dermatologist that's really focused on eczema would be critical. And then a lot of the allergists also see these type of patients. Their nuances are a little bit different. The allergist, probably, I can say this because I'm neither, push a little bit more steroids than the pediatric dermatologist may. And then the other thing is to be patient with your doctor, because it's a chronic condition. They may not get better on the first trip or second trip, but just be patient and communicate. And, they may have to try different things. For you.
Definitely. Now, I love the ideas of, really dealing with this condition on kind of a holistic level. And one of the things that I want to make sure we talked about today is kind of the psychological impact that eczema has on both parents and children. So can you talk to us about that a little bit today?
Yeah, absolutely. I think for the child, they're just uncomfortable and they're not sleeping well. So they're going to be tired. They may not learn as well. And they also need a lot of empathy and sympathy, and, they may climb in the bed with you and a lot of those things. So, the kids are really, fairly, resilient. You just have to be patient with them. I do think that with children, they may also not be allowed to go into situations which will flare them. For instance, if you know your child's going to flare at a play area of a hamburger chain, a lot of those high density areas like gyms and so on can really flare kids. So they don't really understand why they can't play with Johnny, in that area. So I think educating them and being patient and really seeing if you could get them to sleep more whenever there is that possibility would be really helpful. The other things, I would make the bath time, a little bit more fun, because, bathing and all that actually is really, useful, but, get some work done there so that they, brush their, to brush a young child's nail bed is a little bit hard. So, there's also an impact on the sibling who doesn't have a disease, doesn't have a problem. They feel neglected. So you have to, pay attention to that. Now, on the parents, I think the parents, from what I've seen, and those are the people that I've interacted the most, they go through a lot. Lack of sleep is one. Just seeing your child itching and then their clothes are sticking because they've bled through the eczema and so on. That's pretty scary. You have to change clothes at the middle of the night. So the parent, whoever the primary caregiver is just exhausted. So it's going to impact their work and, their energy level. And then it also impacts their relationship with their spouse. So you have to be aware, of those things. And then whenever they go to the doctor, they're tired, exhausted. They're pulling a kid out of school. So that experience in the doctor's office is really pretty helter-skelter.
Yeah, it's so interesting as you're talking about this. Eczema and other skin conditions, I kind of, in my mind, put them in like the really minor category, and as you've been talking, I think that it isn't necessarily that way. Like, it can be a big deal and definitely affect, a child's life and the life of the family. So we're about out of time. I would love any final thoughts that you have for parents dealing with this, or anything that you wanted to get to that we haven't covered yet.
I don't really think so. I think it's just, being patient, reach out to other people. I think there's lots of help out there. There are also new medications that are out, which is going to be helpful. Either topical non-steroidal product is out. There's a heavy-duty monoclonal antibody product that's out. And it's a double-edged sword. There might be too much information and too much connectivity on social media about this. And, sometimes I read some of the recommendations there, and it's, it's really, really quite difficult. But I would say, get yourself to a specialist, because they can recognize the things that can be helped immediately. And the last thing is that if you do have an eczema lesion that's really growing and changing, that could be a medical emergency, because the staph bacteria gets infected, infects the tissue, and it can go deeper. And if you see that the lesion is really expanding and it's getting painful and so on, but it's Friday night at 3 a.m., that's still an emergency. So whenever you have a rapidly growing skin infection, you need to get IV antibiotics, because this thing can, spread into the bloodstream. Not to alarm people. It doesn't happen a lot of times. You have to know when to react. And so if there's any question of expansion of the infection, then I say get urgent care.
Always a good idea to be aware of what we need to go in for. So Dr. Anwar, thank you so much for teaching us today and for helping us understand a little bit better what these skin conditions are and how to work with them. So I appreciate that.
Oh, my pleasure.
Thank you everyone for listening to Moms Who Know.